All right, back tonight here in Focus. The South African Medical Association is calling for the scaling down of what many say is a bloated cabinet by at least half. The association says this will ensure that there's enough money for the health sector to save more lives. On Wednesday, President Cyril Ramaphosa expected, of course, to be inaugurated thereafter, appointing his cabinet of national unity after his inauguration. For more on this, I'm joined now by the South African Medical Association's Dr Mvuyisi Mzukwa. Doc, good to have you, and thank you very much for your time. Others would say 30 ministers, 36 deputy ministers, they largely would cost the country what? Close to about 150 million if you are being generous. The 694 doctors that need to be hired are on the other side of 900 million a year that we would need to be getting. So a cut of 70 million is not necessarily going to get all those doctors hired.
Good evening to you and to your viewers. And yeah, I mean, as the South African Medical Association, we've been invited by this government of national unity to come together, to come to the table, to come up with suggestions and work with this government. So it is on that basis that as the South African Medical Association, we come up with this suggestion to say the first thing in the beginning of this government, we must think about the size of our cabinet. And we're saying that because we're talking about austerity measures that have been put in place by the previous administration, where you find that there is not employment of healthcare workers, there is no progress in terms of attending to dilapidating infrastructure, and also the problem of primary health care that has not been sorted out by the government. So instead of pointing fingers and complaining, we're coming up with solutions. And one of the solutions is that we need to see where money is going. And we're saying where money is going is in the cabinet. Because if you have a minister in South Africa, you will know that that minister would have one house in Cape Town and the other one in Gauteng. And we're not talking about just salaries. We're talking about other perks that are involved, you know, with the hiring of ministers and deputy ministers. And we're talking about an economy that has serious challenges in terms of debt. We know that for every rand, we pay 72 cents to debt, service our debt. Yeah. So, and on top of that, we have stopped, you know, hiring professionals. We have stopped, you know, important services in the country. And we're saying this time around, can we save money where, you know, where it matters in the cabinet, yeah, and take that money to, you know, the Department of Health and other institutions? So
you remember when we were having the conversation around you were saying 800 doctors, the minister was saying, well, on close calculation, it's actually 694. That was in February. One of the things that was said there, which was shocking, was that the report by the Auditor General of the year 2023 showed one particular province having paid 900 million or so in medical negligence claims, saying even if we were to just look at that one province alone, that would be able to hire all those doctors. So not necessarily a cabinet thing that, fine, we might add it to that, but there are bigger savings that we certainly can make that could improve the situation.
You are quite right. If you look at, you know, litigation, we really need to look at the causes of that litigation. And one of the causes of litigation is that we do not have enough personnel on the ground. We think we're saving, well, actually we're not saving, but also we've got broken equipment. We've got all this load shedding and stuff like that in the hospitals. You know, those are all the factors that if you take combine them are causing the problem of litigation. Because if you have fewer medical personnel on the ground, they tend to have burnout and all these other challenges, and they cannot specifically or even accurately attend to the patients. If you have got one doctor who's attending to about 80 patients in the outpatient department, it's a serious matter. So if you are going to be attending to the problem of litigation, you need to attend to the causes of those litigations.
So if we were to look now at where we are sitting, to your point then, I mean, in February, the minister told us 239 posts were advertised, and the following months, another 400 would have been advertised. So if that was February, it's now in June. I would expect that by this point, at least a good 400 of those would have been advertised and certainly appointments made.
Well, even if that is the case, if you look at what has been presented to us by the Department of Health last year, they said, when it comes to doctors, there is a shortage of about 1,000, there are vacancies of about 1,500 vacancies just in the doctors alone. You're not talking about personnel in other professionals in the system. So that number that is being hired is still very small, to be attending to the problems that we are facing at the moment. Hence, we are saying, instead of cutting down on issues of, a healthcare system that are going to account for the quality, high quality healthcare, why can't we look at other measures, in place so that we attend to the problems that we see that we're facing at the moment? We've got, this is a youth month. We've got young people who are highly qualified, who are sitting at home with healthcare qualifications. That, those people should be absorbed instead of us making commemorations and making rallies and talking about statistics as if young people are statistics. We should be doing the right thing, and the right thing is to employ them, into the healthcare system.
And I think that's the nub of the matter, because the president, as much as he's promising to reconfigure his cabinet, he says, of course, I've tasked Treasury and the presidency to look into these things. Treasury and presidency then came up with a rough estimation that if we were to rationalize department entities and SOEs and look at our programs, including what you're saying around all these celebrations and all sorts of things that were commemorations that we're doing, we could save as much as 27 billion rands. And that is something that I think we should be pushing hard for.
Yes, we welcome that suggestion, but ours is to also point out, other areas where we think the government is capable of saving. Because if you look at us, for example, we are a very small economy compared to the US, compared to Japan, compared to Germany. They've got less ministers there, but we as a small economy, even in terms of population, if you compare us to the US, it's about 6 times the size of South Africa in terms of the population. But that they don't have the number of ministers that we have in their cabinet. So we're saying, as part of those measures where we're saying, where can we save, like the issues you have mentioned now, it could be added to the list that we are presenting to the president as we speak.
What's your view then on, as you're saying, you've been invited to also given your views in the GNU as medical professionals, the conversation around whether or not the NHI can be defended by the government of national unity or should be reversed?
Well, I think that the most important thing for us is what is happening now in our institutions. Because if you look at the NHI, it's just the pie in the sky. It's, the government themselves have told us it is going to take decades before we can see the full implementation of the NHI. But the question is, what happens now? We need to think about what we do now. And this is why we're suggesting this, to say we can save, by all these things and even the issues that you mentioned. But NHI is just a road to a universal health coverage. So we need to think about what do we do in the meantime, because it's not implemented as we speak.
So in your view, the GNU should not preoccupy itself with I suppose, the nitty-gritties of NHI more than it should actually be occupying itself with how do we improve the situation now on the ground with things that are low-hanging fruit, so to speak, that it can immediately do?
Yes, that's very important. I mean, look at what we can do now. Look at primary health care. I mean, those are the issues that we attend, low-hanging fruits that we could just attend to them, and the healthcare system is running. And attend to, these savings that you are talking about, from all other sectors, and stop the wasteful expenditure. So if we could do that, we could save a lot of money, and that money could be used, to do what I said we do. We hire more professionals, we build our hospitals, we reach our hospitals, we make sure that there are medicines in the clinics, medicines in the hospitals, and there are no backlogs in terms of operations that are happening there. So we need to be intentional about what we want to do in terms of developing this country and see better healthcare outcomes.
South African Medical Association's Dr Mvuyisi Mzukwa. I appreciate your time. Thanks so much for coming on this evening. Right.